everyone, my name is Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. Today I wanted to actually combine some of my mom background and my pediatrician background and talk about why I decided to enroll my 8-month-old into physical therapy. Alright, so right now it's the first week of March in 2022, and my little daughter Mariam is actually 8 months old. She just turned 8 months old, and I have been working with her for about 2 months on crawling. And before I get into the weeds about physical therapy and why we chose to go ahead and enroll her for physical therapy, I wanted to first talk about crawling. So right now, I am not using this video to discuss the scope of the newest CDC guidelines on milestones that were released just recently. There have been tons of videos put out there, including some YouTube shorts that I have uploaded in regards to my opinion on those guidelines and how they, if they even do, change the way I practice. But this video is not about those milestones or those guidelines on the milestones. In this video, the milestones that I'm referring to are the standardized milestones that I and many other physical therapists and therapists who work with children have used in terms of gross motor to monitor a child's progress. So crawling typically begins at 7 to 9 months of age. Some kids may crawl a little bit before that. I have seen 6 months old who crawl, and some kids may crawl a little bit after that, but for the most part, children should be making some progress in at least trying to crawl, and that could be things like army crawling, or basically crawling on their belly, or even pushing up to their hands and their knees. Now, before to be able to even do that, the child needs to be able to sort of sit independently, so that's another important milestone. Even more importantly, they need to not only be able to sit independently, they need to be able to move out of sitting independently to be able to get into a crawling position, which is actually also showing good control of their hips and their extremities. Now, at around 10 to 12 months of age, you might see their crawling start to advance a little bit, and they can actually crawl over or around obstacles. And so if they were army crawling, they may have been able to now actually crawl onto their hands and knees, the typical way you would imagine a child to crawl. And you might even begin to see them pull to stand. So pulling to stand is incredibly important from a pediatric perspective because it does show good, again, not only control over their extremities, but strength, and then a good milestone and marker to actually being a precursor for walking. Now, commonly, I can actually see pulling to stand happen as early as 9 months of age. I see that very commonly. I also sometimes see children skip crawling, and I wanted to focus in on that. While crawling is a milestone for many babies and something that we'd like them to see, it is not necessarily a milestone to walking. And this is where some pediatricians and therapists butt heads. And because we don't necessarily need it to just walk doesn't mean that it doesn't have tons of benefits. So pulling to stand can be very helpful and a good precursor to walking. Crawling can be an incredibly important milestone and precursor to other things. That is to say that if your child doesn't crawl, doesn't mean that they're not going to grow up to be a successful adult. And I'll give my own oldest daughter's example here. She crawled, I believe she was like 7, maybe 8 months of age, and she crawled for maybe 2 or 3 days and then began to do this very weird like hopping on her knees. It was almost like this like plyometric quadricep tendon move that she did. I don't even know, it didn't look comfortable to me at all, but this is how she hopped around. She didn't crawl, and she did walk within normal time frame. I do believe that she is okay, she's fine. But that being said, there are a lot of benefits to crawling that she maybe missed out on that short little window. She grew up to be successful and, is a very healthy 4-year-old, knock on wood right now. But there's lots of benefits to crawling that I think that we can continue to try to get our children to do. So what are those benefits? Well, it does require weight bearing through the hands, shoulders, wrists, so it's a strengthening postural movement. It also requires visual convergence. It helps with coordination and uses really both sides of the brain to be able to do that. And it strengthens the core. It really strengthens the whole body, and it's a full body movement. So if we can get our kids to crawl, it's definitely encouraged. When are times that children might skip crawling? So there's a few times. Perhaps if there's too much time spent in a container being like a jumper, a walker, which I don't love walkers, but a high chair, times where they don't really get to play on the floor and do a lot of floor time and really get to use those extremities if they're being strapped to sit up versus actually having to use their core to do that. Speaking of weakness in the shoulders, the hips, the core, on the flip side, maybe not weakness, but actually tightness in the hips, neck, or the trunk. And on that note, if they have unresolved torticollis, which can actually also contribute to some of the tightness. So now let's fast forward to my daughter, who's 8 months old, and I first started noticing this in December. We went on a little family vacation, and she was right at 6 months old, and I noticed that she was sitting and she was still needing a little bit of support, which is still very normal at 6 months of age. But because we were on vacation, I really worked with her to try to get her to go from sitting to trying to get into the crawl position, how long she could sustain the crawl, if she was trying to do any army kind of crawling. And again, it was because I was on vacation, I had a little bit of time, and I found that she really didn't like to pivot much. She really liked to just kind of be placed and sat there and really didn't like to be challenged. So we worked a lot on improving strength for her core. At this time, she was already bringing her knees and her feet to her hands when laying on her back. So happy baby position, if you're familiar with yoga, it was sort of doing a happy baby position, which is a good indication also of core strength, but I wanted to work on it a little bit more. So because of that, I actually started looking at positions like tall kneeling, which I've attached some photos here of things that we've worked on. So tall kneeling, where she was kind of doing a modified crawl position with a large toy, so that she was kind of putting one hand down over it, one hand up, one hand down, one hand up, and that really challenges their core and really their spatial awareness. So we started doing tall kneeling. From tall kneeling, we progressed to being on sort of hands and knees, but with a roll, like a blanket. This picture I have attached, it's actually a diaper mat that I had underneath her, sort of placed at her hips. And then I progressed a little bit more when she was doing well there for a sustained period of time to actually putting my leg underneath her. And what that does is that kind of traps her in the position of being on hands and knees. Because the more flexed they are, the better it is, versus a lot of parents think the more they extend or have them on their feet or in a jumper or in a walker, it's going to be better for them. But actually, the more flexed they are, the more they are using those muscles in those joints. So I had her in all three of these positions and we progressed nicely. And then once we were kind of there, and I mastered stability, or I felt that she had done really well with stability, I should say, we worked on mobility. And so I used this crawling activity where I used an empty box and I pushed the box and allowed her to kind of either drag her feet along or push her feet along. And in the beginning, I expected her to not do much. So I'm pushing her legs here. And I used a lot of encouraging props, food, toys, her older sister, who she loves, and she would either sort of pivot and default onto one hip, give up, get frustrated, or just kind of thoroughly not enjoy the activity at all. And whereas I'm a pediatrician and I was spending a lot of engaged time with her on playing, the last thing I wanted was her to become frustrated with playtime, because once they get frustrated, they resist trying to really push themselves. And by pushing ourselves, that's where our curiosity comes into place, and that's where we try to challenge ourselves and meet more goals. Curiosity is so important to helping children advance. So if she's getting to a point where she's frustrated and that curiosity and that spark isn't there and she instead wants to resist it, then I'm obviously forcing something that's not ready to happen. So I took a step back and wanted to instead focus again on stability, and this time really try to strengthen her core. So I don't have a picture of this activity, but I tried to do more like sort of wheelbarrow walking, but not really the walking part of it. Instead, just holding her in wheelbarrow and really trying to support her lower body and allow her to strengthen sort of weight bearing through her hands, wrists, and shoulders. Again, I found that sometimes she would do well and sometimes she really resisted. Every time she resisted, she would try to usually turn to one specific way. She did turn both ways, but one side she definitely favored a lot more. So like 8 out of 10 times she would turn to X side. Personally, as a pediatrician, I noticed no hypertonia or hypotonia, so increased or decreased tone. I didn't notice any issues with muscle bulk or tone. I felt that she was meeting all of her developmental milestones. I felt that she was growing well, socially, emotionally, cognitively, everything, fine motor, I was very happy with and found no red flags. However, what I was doing was looking ahead at her next milestones, and I was afraid that she will then be a little bit behind the curve if she didn't meet her next milestones, if she didn't get the help right now. So I wanted to do a physical therapy evaluation. At this time, I was working with her pretty intensely. So January, February, about 4 to 6 weeks, I was pretty intensely trying to do some very engaged playtime with her. Before I left for work, when I came back from work, I was trying to be very consistent amongst her different caregivers. So me, her father, her nanny, about how to really make sure that we were engaging her and not keeping too much container time, making sure that we were trying to challenge her, and just trying to see across the board, was she getting frustrated each time? Was she getting frustrated at only a certain time of day? Was she only getting frustrated with me? Was I pushing her too hard? So I really thought about this very intently. And I did feel that I wanted to get an expert's opinion in terms of physical therapy. I'm a pediatrician, but am I a physical therapist? No. And so that's what I actually brought up to my pediatrician. And here's the kicker. The pediatrician actually didn't agree with me, and he mentioned a few reasons why. He listed the lack of certain red flags. She was able to right herself, so if she's sitting and lost her balance, she was able to right herself. He was very proud of the way she was extending, but on a note that I mentioned earlier, it's very easy for children to extend versus flexion actually requires a little bit more work. So in my opinion, just because the red flag isn't there doesn't mean we disregard the parents' concerns. So the way I kind of left it with him was, I get what you're saying, and I do feel this because I am looking a little bit ahead of the curve and I don't want her to necessarily fall behind. I'm pretty sure she will, because I'm trying my best here and she shouldn't be getting this frustrated all the time. And I told him that I wanted to go forward with at least an evaluation. And if I don't agree with the physical therapist, I don't have to go forward with a treatment plan. So for that reason, we didn't go through insurance. We paid cash for an out-of-network physical therapist. In fact, we live in New Jersey. Many therapists are out-of-network in other states as well. So it was actually something that I wasn't surprised by. And I went forward and I booked 2 physical therapist evals. The first one came to our house. I didn't love it, so I'm not going to focus on that very much. The second one, we actually went to her office. And what's really funny about having a little one that's like right at this age of 8 months is stranger anxiety. So trying to get a stranger to do an evaluation on them and manipulate them and watch them play and be around them while they're crying and they want their mom and they're around strangers is a very nerve-wracking, difficult experience. But here's the thing, guys. We people who are working with children, like pediatric physical therapists, occupational therapists, speech therapists, pediatricians, we know how to work with children. So our job is to be able to do our job in spite of how your child's acting. And that's one thing that I often hit home to parents. Like, I am able to actually do my job despite your child not being cooperative. And I was really happy to see that actually from this second therapist that I liked a little bit more, that we went to her office. She was actually really doing well, working around Mariam through her stranger anxiety and her sort of hesitation to still do an exam and an evaluation. So at this time during the evaluation, I had been working with her pretty intensely for about 4 to 6 weeks. And so just even getting stability on all fours, being able to pivot, which is huge. Like I said, go from sitting to then being able to pivot, trying to work on side sitting. All of those things were things that I had been working on, but I felt I wanted her to get assessed. So she had just very recently gone from being able to lay down to being able to sit up, which requires a lot of core strength, But I did find that she had some restriction in mobility, and the physical therapist that we saw actually called these sort of more soft tissue restrictions, which could have been very much due to just presence of in utero molding. So the positions that she may have been in utero just may have sort of stuck around a little bit longer. My little one did have a little touch of torticollis when she was born, so sort of that stiffening of the one of the muscles right here in the neck. So I worked on that on my own at home and resolved that by about 3 to 4 months of age. But sometimes you can have residual tightness in the hips, or just soft tissue restrictions, actually less so tightness in the hips, but soft tissue restrictions that sort of those patterns can persist. So that's why I felt that it was really useful for me, even as a pediatrician, to get that sort of eval. We all have our crafts that we are experts in, and this was very helpful for me to learn. We worked on lots of specific holds, what her preferences were, and this is, I thought, very important. Most physical therapists, including adult physical therapists that I work with, once they identify what a weak spot is, they like to sort of like work on strengthening that weak spot. And this physical therapist went in a different sort of route, and her school of thought is actually, rather than strengthening the weaker side, work on strengthening the stronger side. And I thought this was really interesting. She actually gave me her book to read, and I actually have been reading it, and she discussed sort of our confidence and how important it is. And so by actually allowing a child to work and strengthen the side that's already stronger, they become a little bit more confident and adept at doing that skill. And then naturally the weaker side, they will begin to use that side. It helps them increase their confidence while they're doing it. It helps with neuroplasticity, so helping the neurons know where to fire, helping them to activate the appropriate muscles, and knowing that the weaker side does follow. So rather than really destroying the kiddo's confidence or making playtime very frustrating for them because they're constantly feeling weak or feeling off kilter, I thought this was really helpful for me to learn, like when to necessarily embrace the stronger side and when to sort of challenge the weaker side just a little bit, but not enough to frustrate her or to make her uncomfortable or to make it feel unnatural to her. So I personally found that very enlightening. I love that we could highlight her strengths while still continuing to improve her skills. So there you have it. And that is just my personal experience. I really want to emphasize here to families that just because this is my daughter's experience doesn't mean that's your child's experience. Just because this is my insight doesn't mean that your pediatrician may be necessarily wrong. I so agree with speaking up and advocating for yourself. My pediatrician isn't there with us all the time during playtime and doesn't get to see the frustration that I see, or doesn't get to see the unwillingness to really challenge themselves. So that's why I spoke up and advocated. And I will say that was a big learning point for me, even as a pediatrician. Like, yes, there's no, red flags that are checking off. It doesn't mean we necessarily disregard or write off the parent's concern. And I don't in my practice, because personally I'm a pretty proactive pediatrician, but I know how some parents may not get long periods of time with their pediatrician and don't get to really advocate and have that dialogue back and forth. So yes, we wanted to do it from an eval standpoint. It was a really important and knowledgeable experience for me. We did have to pay out of pocket, but it was very valuable for us to really have that eval and then create that treatment plan for our daughter. I was also able to learn that it wasn't necessarily something that I was doing wrong. I knew she didn't spend too much time in containers, but did she have unresolved mobility restrictions from the torticollis, or was it tightness in the hips from something else that was going on? Was it low muscle bulk or tone? Because I didn't sense that. So it was very helpful to me from that standpoint, because that isn't what my wheelhouse is. I'm a pediatrician. I'm a primary care physician, but I'm not a physical therapist. So I hope this was helpful. Baby is doing very well. I know this video is running kind of long, but it was important for me to share this information. If you have questions, make sure you ask them below. See you guys in the next video. Bye.